This study examines the incidence, etiology, and prognostic implications of spontaneous myocardial infarction, MI, in the context of left main coronary artery disease. Data were collected from the EXCEL trial comparing percutaneous coronary intervention versus coronary artery bypass graft surgery. The authors used Cox proportional hazards regression to analyze associations between spontaneous MI and mortality over a 5-year period. The study included 882 patients undergoing left main coronary revascularization, integrating both procedural and retrospective multivariable analyses.
Quick take. Patients undergoing PCI had a higher incidence of spontaneous MI than those undergoing CABG over a 5-year follow-up. The EXCEL trial provides new insights on long-term risks associated with each procedure.
Results showed spontaneous MI occurred in 6.8% of patients after PCI, compared to 3.4% following CABG, based on adjusted hazard ratios. Spontaneous MI was a strong independent predictor of both cardiovascular and all-cause mortality. The effect was consistent across both intervention types, with a significantly higher associated mortality risk than large procedural MI. The authors conclude that spontaneous MI post-revascularization has a crucial prognostic impact, more so than procedural MI.
Quick take. The analysis highlights a significant mortality risk associated with spontaneous MI, consistently observed after both PCI and CABG. These findings suggest a need for vigilant long-term monitoring.
Short quiz, clinical vignette. Question: following LMCAD revascularization, what procedure is associated with a higher incidence of spontaneous MI at 5 years? Option A is percutaneous coronary intervention. Option B is coronary artery bypass graft. Option C is both have equal incidence. Option D is endovascular repair.
The answer is option A. The EXCEL trial found that spontaneous MI incidence was higher following percutaneous coronary intervention compared to coronary artery bypass graft.